This lecture is on bone development and growth. I gave it to each section, however, I'm recording it now. So we're going to talk about bone development and growth. So to start with, bones are grouped using different methods, including the embryonic development, shape and structure of the bones, and location of the body. This lecture is going to focus on bone embryonic development, and we will see that embryonic development has two basic bone classifications. One is endochondral ossification, and I want you to focus on the chondral portion of this statement, which means that we know that this has to involve cartilage because endochondral. Intramembranous ossification involves a dense membrane of mesenchyme tissue that becomes bone. Both types of ossification, and ossification just means to build bone structure, not the calcification, just the protein and Haversian system structure. It depends on oxygenation because remember, bone is a vascular tissue and needs oxygen. So we have to think about when is the oxygen arriving and how, what our starting tissue is, and our location, because we always have to think about location. So we're going to start with parts of a bone. The ends of the bone are called an epiphysis. Each end is a separate epiphysis. The proximal end and the distal end each are an epiphysis. The middle of the bone is called the diaphysis. That is the bone shaft. It's formally called the diaphysis of the bone. And we're going to start with endochondral ossification. Endochondral ossification happens early in fetal development. It is the earliest form when we start to form the basic framework of the body. Remember I said when we looked at hyaline cartilage that hyaline cartilage forms most of the fetal skeleton, so that's what we are. We're looking at endochondral and hyaline cartilage. Remember that cartilage is avascular, which means that it can handle a very low oxygen environment. And it has to, because this even happens before vascularization happens. Remember that in the fetus, that the heart starts at about week 10, and the vascularization of the body starts at about week 12. This is actually happening before them. We start to get the first cartilage model before the heart actually starts to beat. Over time, the hyaline cartilage thickens, it dies, which is normal, and new mesenchyme cells come in to replace the cartilage with bone cells. Where does this happen? All the bones inferior to the skull except for the clavicles. So the clavicles are the other kind, but all the bones inferior to the skull are hyaline cartilage model. So here's what we get. We get the hyaline cartilage model, which is built of the blue cartilage in this picture. And what we see is that about week 12-ish, when the blood vessels first are starting to come in, we get a bone collar around the cartilage model. So this is the bone collar. I've just highlighted one piece in red. We don't have fully bone. It's not fully vascular yet. But as the cartilage thickens, the center part dies. And that is what we call a normal cell death or programmed cell death. Some books may refer to that as apoptosis or apoptosis. And the key here is we get this cavity in the center, which I've just highlighted in red. And that cavity in the center is very important because it becomes the medullary or marrow cavity in the diaphysis, but it means that we have an edge. And these dying cells release calcium and other chemicals that will draw in a new artery. Right? We get a new artery coming into the bone because vascularization has started. So that's going to go into the pocket. And when it does that, it's going to bring with it new mesenchyme cells. So the cartilage has died and new mesenchyme cells come and start to lay bone down. Now, this is about month 3. So we're looking at week 12 to 14 now. The blood vessels enter. They have their own drawing of the artery. And we start to see that the bone starts to lay on the inside of the marrow cavity, and it's going to grow from the inside towards that bone cavity because this is mesenchyme comes in and becomes bone. It's called primary ossification because this is the first place in the bone that we start to make bones. Notice that the ends are completely, the epiphysis are completely cartilage still, and it will continue until the whole bone diaphysis is done. It starts at about month 3 and it goes until about month 6 before we have the full diaphysis. So this process takes about 3 months. Then at about month 6, the third trimester, we see more blood vessels come in and we start the same process on the ends, on the epiphysis with the calcified pocket. This is called secondary ossification because it's the second place we start. Each end counts as secondary because they started about the same time. And again, this brings blood vessels in, the epiphysis cells die, and we bring in new mesenchyme cells to start the bone formation. One of the things about, if you've ever been at a baby shower where they did a trivia game about how many bones does an infant have, and it's somewhere over 300, that's because each bone actually counts as 3. Each epiphysis is its own bone at this point, and we have a lot of cartilage still separating these bones. So this will continue. Then in childhood, we're looking at basically post-birth, although if you look at a newborn's end of their bones, it's still pretty much cartilage. So we have the bone diaphysis with the medullary cavity. Each epiphysis is bone. We will keep the end cartilage, which I've just circled in red. That is the articular cartilage. That will stay your whole life, at least you hope so, because that was going to become part of the synovial joint. It forms the friction-free surface for a joint. If you wear through that cartilage or that cartilage dies, you wind up with osteoarthritis. But there's also hyaline cartilage through your childhood that is maintained at the epiphyseal plate, also known as the growth plate. That's cartilage because cartilage grows interstitially and bone cannot. So this is how bones are actually going to get longer, is this growth plate. And this will be maintained throughout your entire childhood until your teen years when you stop growing. And I mentioned here that the hyaline cartilage grows interstitially and bone cannot, but it's still part of endochondral ossification because hyaline cartilage is involved, right? So I have this drawing, this art rendering from your textbook that shows that this is the epiphyseal plate. Now, up at the top, this is where the epiphysis is. And this down here is at the bottom is where the diaphysis is. And the key to this is when you are growing from throughout childhood, you have dividing cartilage cells. And those dividing cartilage cells, as they grow, they push the epiphysis outward. They push the bone longer. So this is what actually makes the bone longer. This is how, you get that growth spurt, maybe in your teen years that eventually they stop growing. If you've ever had growing pains that can actually grow so fast that it makes your bones ache, that is real, or it makes the muscles ache around them. After the cells have divided, then they start to age, and you see where it says older enlarging cells. Some books will use the word hypertrophy, meaning they get larger, and then as they get larger, they calcify and they die again. This is planned so that the osteoblasts at the end of the diaphysis can start to build in new bone. So the diaphysis is growing also in the direction of the epiphysis outwards by putting new osteoblasts on the end of the bone, and then in the middle is the dividing cartilage cells. So our final bone, we get an outer casing of dense or compact bone. This is the structure you looked at. Notice that this dense bone goes all the way around the outside of the bone. Some areas are thinner than others. The diaphysis is usually very thick. The epiphysis might be just a thin shell. Inside is spongy bone, which is also called trabecular or cancellous bone. Pick the name you like. And even though it's called spongy, it isn't truly soft. Instead of being soft, it's actually quite spiky, but this is where we put the red bone marrow to make blood cells, goes in this space. A lot of osteoporosis is less to do with the reduction in dense bone, But imagine half the spongy bone gone. You lose the inside structure and the outer dense bone cracks like an eggshell. So we need this spongy bone to maintain the strength of our bones. So that is endochondral ossification.